Welcome back. I hope everyone had a good break and are ready to hear about improving the performance of our health systems with this esteemed panel. I am going to invite them to introduce themselves. Can I please start with Andrea?
Thank you, Jody, and thank you, everyone. Thanks for having me here. So I'm Andrea Marazzi. I'm the head of pharma for Novartis here in Canada. More than 20 years in pharmaceutical, a passion for working with a system and helping the system to get better and drive more patient outcomes. And just briefly about Novartis. Novartis, as you probably know, is a global innovative medicine company whose purpose is really reimagining medicine to improve and extend people's lives. We operate to discover and develop breakthrough treatments. We reach 10% of humanity, so we have served close to 800 million patients around the globe. And our portfolio is really focused on high unmet medical need, like cancer, cardiovascular disease, immunology, neuroscience, and cell and gene therapy. When it comes to Canada, we are present with more than 1,000 people. And as I said before, we want to really be as innovative as we are when it comes to drug delivery and drug implementation. So we are an engine in terms of drug discovery. We want to innovate and make sure we can serve as many patients as possible in partnership. And this is, I think, it's a key word for all of us. I just want to mention a couple of things. We are very committed in supporting innovation in the Canadian healthcare system. And we invest on average we've invested on average in the last 5 years, almost 50 million in research and development. And we know how critical is this for a life science strategy in a country. We don't stop here. I think the other big commitment that we have is for digital partnership and healthcare solution. We have also invested in a number of local companies. The tech ecosystem is massive in Canada. We have a long-term commitment, and we have launched, probably heard about it, Novartis Biome in Montreal in October 2020 is a platform that is really trying to bring the best of healthcare, data science, technology to converge and solve big problems. Thank you for having me here.
Well, that's an awesome introduction. It portends well for our discussion. James, can I please invite you to introduce yourself?
Sure, thank you, Jody, and merci beaucoup tout le monde pour l'invitation aujourd'hui. My name is James Brody, and I'm the general manager of Johnson & Johnson MedTech here in Canada, and have spent 25 years in both the J&J biopharmaceutical business and MedTech, working within the Canadian health system. And as the largest integrated pharmaceutical and MedTech company in both Canada and globally, J&J has been among others, at the center of supporting Canada's healthcare system during this pandemic across our full range of products and solutions. And we've joined many companies in our sector, including some of the ones represented today and in the audience, in stepping up on securing key supplies, including essential medicines and technologies. We've worked really hard to find new ways to support healthcare professionals who've been burdened through this crisis. And today we are all working tirelessly to propose new solutions to address not only surgical backlogs, which I'm sure we'll talk about today, but that might ultimately step up the resiliency of our health system in general. Minister Duclos spoke of this earlier today. The pandemic has really encouraged all of us to step back and really think about our health system and how we can make it better, more agile, more responsive to the needs of Canadian patients. And it's a critical conversation that deserves our full attention. So maybe to frame today a couple of reflections. First, the pandemic has really driven home just how important productive relationships are across jurisdictions and amongst public sector, industry, and other key stakeholders. And again, Minister Duclos aptly spoke of this, speaking of the pandemic helping to cement both the value and the process of collaboration across these stakeholders. And our system ultimately adapted in this way during the pandemic. We need to retain that good progress. And the second, critically important as well, now more than ever, is that Canada embraces the notion of developing and implementing an integrated strategy for advancing the wider life sciences sector, and was really pleased to hear Minister Duclos' comments on that. Again, a topic of the day. And if we think about that, there's probably three key lessons from global best practices for us to take on board at the federal and provincial level. The first is a whole of government approach on these strategies. I think we can all agree that in this wonderful federation that we live in, the complexities arise in the delivery and management of health precisely because of the federal, provincial, territorial interplay. So I think that's critical. The second is really a focus on execution. And I don't say this lightly or blithely. The reality is there's a lot of great work that's been done, and Jody, you're well aware of all of these, white papers, policy position papers, et cetera, on how to advance our system. Let's not reinvent the wheel. Let's just work on, the key aspects of these and drive progress. And then the last is really what Minister Duclos celebrated earlier, this notion of a collaborative approach. How, diverse and valuable perspectives across industry, providers, government, and others will help solve the complex challenges that we're ultimately facing today. So I think maybe in closing, underpinning these learnings, we ultimately need to build on the valuable lessons learned throughout the pandemic and ultimately shift, I believe, to a focus on valuing patient outcomes and viewing health and the life sciences sector in particular as a wealth creator versus a system focused, as it has been in the past, narrowly on cost to be managed. Supported by the emerging policies Minister Duclos and other provincial leaders have recently been tabling. We really need to live into what, and Jody, I think you'll appreciate this, what Senator Harder's vision was of a grand alliance, right? Whereby not just government, but academia, industry, citizens, all of us work to build a diverse world-class life sciences ecosystem here in Canada that's integrated globally. So this will, in my estimation, not only protect us from future crises, like another pandemic or other economic shocks, but build a more resilient, sustainable sector that fuels not only advances in human health, but the economy at large. So a little bit of framing, thanks, and look forward to the rest of the discussion with my esteemed colleagues here today.
Well, another inspiring introduction. Thank you so much, James. Janissa, over to you.
Thank you for the warm welcome, Jody, and thank you for having me today. I'm very pleased to join my fellow panelists for today's discussion and would like to also thank our participants for joining us virtually this afternoon. I'm Dr. Janissa Naidu. I'm the Chief Scientific Officer, Chief Medical Officer, and Vice President of Clinical Development and Quality Assurance at Dynacare. I'm a physician and pathologist by training and accountable for the delivery of a comprehensive service in Quebec, Ontario, and Manitoba in clinical services, pathology, genetics, core laboratory, and quality. In my role, I also work with various public health agencies and accountable for regulatory and medical affairs and new product development. I've been with Dynacare for over 12 years and in laboratory medicine for over 25 years, working in various healthcare sectors. Dynacare's parent company is LabCorp, which is a global organization based in the United States and one of the largest clinical laboratory networks in the world. Through LabCorp, we have access to research and development and capital that is unprecedented in the Canadian private healthcare space. At Dynacare, we have more than 50 years of experience in the Canadian market and have grown significantly over the years to include 7 state-of-the-art laboratories that perform over 65 million tests for more than 4 million Canadians annually. We operate more than 200 specimen collection sites in Manitoba, Ontario, and Quebec, and provide transportation service in BC and Alberta. Through this network, our 3,200 employees support many physicians, hospital clients, and workplace clients. Dynacare is at the forefront of healthcare innovation, specifically through decentralized diagnostics, point-of-care testing, molecular and genomic testing, and as well as digitally enabled healthcare. And we will talk more about it in today's discussion. The COVID-19 pandemic highlighted opportunities for private organizations such as Dynacare to complement the public healthcare system. From the outset of the pandemic, Dynacare implemented a COVID-19 strategy that was robust and strengthened our pandemic preparedness and focused on health and safety of employees and patients and a very robust testing program. The outcomes of our preparedness strategy were very successful. We launched new testing methods and were able to lead a rapid scale up in testing capacity, ultimately leading to over 3.5 million COVID PCR tests. We also led implementation of innovative technology, including novel techniques such as saliva and home and self collection. This enabled us to maintain a competitive market positioning, which was integral to procuring federal contracts for testing temporary foreign workers and the border testing. With this solid infrastructure that we created, we can now build on various programs to prepare us for the future, to improve outcomes and improve collaboration going forward.
Well, thank you so much. I love the optimism in your comments, as well as some of the more sobering challenges you've highlighted too. I'm Jody Butts. I'm thrilled to be your moderator. I've been working in the health sector for over 20 years, and I've held leadership or advisory positions in digital health, acute care, mental health care, as well as home care. So just really looking forward to tapping into all of your experience and expertise in this discussion. So let's talk about the pandemic. You know, obviously such a difficult time, still not quite through it. But there are some things we can be proud of. There are achievements we can point to. I would love to get your thoughts on what those are, and really, you know, place a forward-looking lens as we think about those achievements. How can they spin into something good out of this really terrible situation? And Janissa, I'm going to invite you to go first.
Thanks, Jody. So at Dynacare, with sustained support through decentralized testing collections, we were able to alleviate pressure from the public healthcare system, where we performed, as I mentioned, a large number of PCR tests since the beginning of the pandemic. We also saw, which was unique, and one of the first times that we actually encountered this, was the public-private partnership, which worked very well. And this is a model that's required to continue to help alleviate growing demand as our population increases. This collaboration that I talked to between the various groups was truly unprecedented. It was between it was government agencies, vaccine manufacturers, testing laboratories, collection networks. And this actually enabled us to reach a rapid scaling, which was required to meet the demands to manage the pandemic. We also had, which I spoke to in my introduction, the ability to innovate. We were able to actually do it in a very timely manner. And personally, at Dynacare, we actually launched the saliva method as a new technique in COVID testing. We also were able to ramp up home and self collections that were actually not seen in the past. And with both that in mind, we were very successful was through a partnership with PIAC. We were able to conduct border testing at the major hubs in Montreal and Manitoba, where we performed more than 500,000 COVID-19 tests and 120,000 virtual collections in a very short time frame. You know, and with this innovative technology, we were able to serve that underserved, vulnerable communities like saliva and self-collection. And with testing methodologies that we actually launched during the pandemic, the Dynacare Brampton lab was the first to actually screen for the variant of concern for both Delta and Omicron. So a lot was done in the pandemic, and we need to actually expand those capabilities into the future to prevent and get ready for other crises.
That's really heartening, because there's, you know, a whole cottage industry dedicated to all the things that went wrong, and it's important we reflect on the challenges too. But that's really great to hear how this, you know, terrible time did lead to some positives. James, can I invite you to add to that?
Yeah, I mean, first, I think it has to be said, I think everybody here, I hope everybody would agree that from a global perspective on just about every level, case counts, hospitalizations, mortality, vaccination rates, you know, our governments, PHAC, public health authorities, et cetera, did a phenomenal job shepherding us through this pandemic. You know, of course, there were hiccups around vaccine procurement in the early days and inconsistent public health measures having disproportionate impacts on certain industries that are probably represented here today in the audience, travel, hospitality, et cetera. Important things we have to address, but our response from purely a public health perspective and in general, the response of Canadian people should be, I think anyway, a source of pride. So let's not forget that. But I guess more specifically to the question at hand, the life sciences industry, including J&J and the panelists here today, the companies we represent, really stepped up in innovative ways to strengthen the supply chain. Continued challenges today, obviously globally across all industries, but of vital devices and health solutions. And the common theme seems throughout the day is this notion of collaboration, right? Janissa was mentioning that as well. And so, many global and domestic companies like 3M, Baylis, Abbott, ourselves rallied to secure, make PPE, ventilators, rapid tests, and of course, vaccines at record pace. And then from a government side of things, just look at what Health Canada did from a regulatory agility perspective to create, new processes around interim orders, et cetera, to fast track diagnostics, therapeutics, and vaccines in the Canadian context. So that was huge and something we can try to lean into in future crises as well. I had an ongoing real-time dialogue with governments. That collaboration I spoke to around a supply chain of critical medicines, medical devices, et cetera. That integration in data and insights, it was critical, and ideally we maintain that going forward, particularly given the challenges of global supply chains now and in the future. I think the biggest shift, though, came very specifically, and probably all of us felt this, any of us who actually sought healthcare in the last couple of years, was virtual care, right? If you think about, I live and get my healthcare in Ontario, but if you think about the last decade, all the debates and conversations around e-health and trying to get a doctor's appointment virtually or getting helped on more than one diagnosis or whatever, all challenging, right? And literally overnight, that all changed. And governments, to their credit, have now institutionalized those changes with billing codes, all these kind of things that allow care providers to manage care virtually. So I think that's another thing that will drive efficiencies, ideally patient experience, and maybe even outcomes going forward. So all good. I'm sure we'll talk to the challenges too, but certainly some good have come of it. So.
Oh, for sure, for sure. Well, thank you for that. Andrea, how would you like to add to this leaven of successes?
I'm not gonna repeat. I think Janissa and James, you said it for me. Collaboration, the way the industry, together with a partnership of different stakeholders, they were able to bring vaccines at scale, at speed. It's been incredible. I think you touch on it, James. I want to also compliment on the regulatory process and access to innovation, vaccine therapeutics. I think the agility of Health Canada has been, impressive and progressive, and this is great to hear also for future innovation. I want to mention something very, very, specific to Canada. And at the beginning, we had a number of challenges, but I want to highlight, the strong and seamless, data management, because, all the health data management will be a key topic for today, I'm sure. And what we saw in the provinces, from, the vaccine passport to contract tracing to the management of vaccine, has been, personalized, seamless, at scale, speed. So I think, the reflection I have is, how can we do this more? In other area, how we can make sure that we leverage, the health data infrastructure that we have, and we utilize those data to, better serve patient and reach better outcomes. So this is, something, key. And the last element that I think was very evident was, solving such a big problem needs to really, needs to bring, the right people around the table. So I think it's important really that we mobilize, the right stakeholder to solve for the right problem. The approach we took, as Novartis, is really opening up, a conversation with Health Canada and some of the institutions at the very beginning to say, how can we help, right? Instead of, going everywhere. So that's where, starting from there, we took action such, the creation of a global fund, of up to 20 million for communities around the world impacted by COVID. Also, we decided to really join R&D effort with Bill and Melinda Gates Foundation to make sure that we were able to do something, collaborative. We conducted some clinical trials where there was some need for that. And I think, you touched before also, my panelists as well, the community, the impact on community. So we were able to create a fund to, support local community, to the fund, the Food Banks Canada and United Way. I think that's important, that we also find our place to really solve for the right problem.
Excellent comments. So I'm going to quote all of you. I've heard words partnership, collaboration, alliance, cooperation. So the question is, can we keep this productive relationship between governments and government agencies on the one hand with industry outside of a crisis? Or is the secret ingredient crisis, and that's what has allowed it to happen? James, I'm going to invite you to jump in on that one.
Sure, and I'll speak out of both sides of my mouth with optimism and then cynicism, if that's okay. So just because of the watch out here, I think the biggest lesson learned, we've all just agreed, and Minister Duclos framed it from the government perspective as well. Collaboration simply works. I mean, I look at this from a purely academic perspective. It's consistent with all of our learning around diversity, right? As business leaders and academics, is diverse points of view always drive more ingenious solutions to complex problems, better innovation than do homogenous work teams. I think we've all learned that in our own businesses, and certainly government is learning that as well. So we all have key roles to play together to evolve our system, pandemic proof it, as I like to call it, and bigger than that, ideally create a more sustainable and integrated model for the future. And a hallmark example of this, I mentioned earlier, was the collaboration seen in the development, licensing, and rollout of vaccines in Canada, where J&J played a critical role, certainly globally, and to a degree in Canada as well. And as I said, Health Canada created agile and progressive licensing processes to make that happen. And in a way, we all partnered with the provinces to roll out vaccines. Really good example of that in terms of getting shots in arms, best amongst the world. As to the question of, here's a cynic, as to the question of whether or not it could continue, I think time will tell. I'm certainly buoyed by the echoes of the life sciences strategy across the major provinces and at the federal level, but I worked in this health system when SARS hit us all, disproportionately in Canada than most other jurisdictions in the world. And it taught us a bit of a cynical lesson. It's that, as crisis abates and as the reality of recovery and 2 or 3 years of lost policy progress sets in, is there this inexorable pull to status quo, right? And does that win the day? So that's the watch out. But I'm buoyed by a lot of politicians, a lot of policymakers, a lot of industry leaders speaking of just the value of this collaboration and the fact that we might have figured it out. And to your point, there's so many positive examples. I'm optimistic they'll stick.
Well, great perspective. Janissa, did you want to jump in on that?
Yeah, so just to add to what James mentioned, that and what you said, collaboration seems to be critical, that's required to go forward. And what we saw, when we looked at the care gap over the pandemic, and there's 2 suggestions that can actually move us forward. One is, which we spoke to earlier, and I think all our panelists spoke to, is virtual care. So to continue decentralized collections and diagnostic testing. And also you need to actually have proactive planning from the various government agencies and healthcare agencies. Now, and that's a fundamental requirement to actually move forward, which would then require collaboration and innovation, and also, vague planning and preparedness for disaster and pandemics. And what else I want to talk to is 2 other pieces, which James touched on already, was the collaboration, but this public-private partnership. We saw it, and we saw it successful over the pandemic, and we need to now take it through, not just for crisis, as you stated, Jody, but even for just healthcare in general. And this public-private partnership can support a surge in capacity while maintaining essential services, if we can actually remove diagnostic collections and testing from the public healthcare system. So this collaboration can actually help us, not just in crisis mode, but just on a regular basis. This public-private partnership and collaboration will deliver a patient-centric model and a far more effective management of surges due to any public health crisis. So I think this is one of the areas that I think we really need to actually focus on when we move forward. The last thing that I'll do without, I don't want to take up too much of time, but what we found is educating the public and getting buy-in and trust early is key. So messaging needs to be standardized, consistent, and repeated. And trust and capability in our experts is critical. So we need some work to be done in that area to actually build trust in our public, and also and build our expertise panels in our scientific and life sciences areas. And make sure we manage misinformation and disinformation, because that's truly a second pandemic of its own, and it needs to be managed accordingly. So we need to make sure that we don't actually encourage those small groups of vocal minorities which can derail the discourse. And that's only with providing the right information at the right time and in a transparent fashion. Okay.
Yeah,
Thanks,
that's an excellent point. Obviously, both the opportunities and the challenges are complex, but there's so much we agree on, right? Between whether you're sitting inside the public sector or sitting inside industry, I think we can all, as but one example, agree on how pernicious, misinformation and disinformation can be. So it's a good reminder. Andrea, did you want to jump in on this idea around partnership and collaboration, and can we keep it going outside of a crisis?
Yeah, I think never waste a crisis, and I think why I'm optimistic. I'm optimistic because I think what has happened with COVID is really shifting the perception of investment in healthcare system as value and not cost, right? And I think this is the big premise. If we see this is a source of value, and I see in many, the federal level, provincial plan, they're saying this is a source of economic recovery. This is a source of societal progress. If we place as it should be, and as we're seeing during the pandemic, healthcare system in that position, then I think we will be able to find what I call, the sweet spot of win-win-win, where patients win, the system wins, and private, stakeholders do. And probably in the past we were at best trying to draw, or not trying to find this triple win. So I think this is absolutely going to change and hopefully move in a direction where we can see this more consistently. And the other thing is, it's not that we're missing big problem to solve. Actually, out of the pandemic, we call it syndemic effect. We see the convergence of pandemic, other epidemic. If you think about the chronic disease management, the elderly population, the underserved community, we have big problem for society and humanity to solve. And now it's the time, because if we want to be better prepared for the next crisis, which hopefully it's not going to come, but if it comes, we are ready for that. We need to make sure we serve those population. We proactively manage those disease early on, and we can do it. We can do it together.
Great, that's inspiring, and we already have our first question in. So clearly, all of your comments are connecting with our audience. So I'm going to shift to that. We've mentioned the health system. It has been the front lines on this pandemic, together with all of you. It's strained. Clinicians are burnt out, and the pandemic also really showed how challenged we are to deliver care in an equitable way, to reach everybody who needs to be reached. Janissa, you mentioned that in some of your remarks as well. So how can the life sciences sector really step up to help the system recover as well? And how can we do that in a way that keeps health equity at the forefront and is driven by values? Andrea, I'm going to turn to you first for that one, if you don't mind.
No, thank you, Jaren. I will be brief so that we can share, have a equal and good discussion. There are three things that and I'm going to be brief and bring some examples so that we we're also able to bridge like big concept with reality. I think one is strengthening community of care. It's clear we need to bring care as close as possible to patients, their homes, because especially in Canada, I think we have a number of those challenges. So this is one. Second, leveraging tech and data to drive insights, create efficiencies, so that eventually we can really make sure we implement innovation, removing all those clinical and non-clinical barriers. I think life science sector can really support patient care, resolution of gap, and really reimagining the system. I think we are at the point where we can say we have a good system, but can we do something together? And I want to bring two examples on what are we doing. One is I think we're really proud. We in a recent collaboration, and again it's about collaboration as James and Janissa, you said before. It's this is the key word, and it's something that is going to change things for the better. So we just entered into a collaboration with Alive Core Technology. Is the first partnership in oncology, and it comes from the Novartis Canada Biome Innovation Hub. So what we do is with an electrocardiogram, we're able to test and done the testing with a device and a specialized app. So this project will enable better access to testing for breast cancer patients in a very, very simple way, and with results that are available through web portal. You see, this is community going and reaching out to patients and ensure this equality of care. The other one is something we're again very proud of. We entered into a partnership, collaboration with Inodem Neuroscience. MS, multiple sclerosis, is one of the biggest challenge for Canada. It's actually, the prevalence it's very, very high compared to any other part of the world. We have more than 100,000 Canadians that they live with this very challenging condition. So what we are doing with this partner is we are starting our eye movement biomarker through a simple pair application, can support clinicians in analyzing highly sensitive data to basically detect disease progression early on. Can be done again, at home by patient themselves, and this will really help to manage the disease and avoid that patient they get too sick. I think that's what we learned through the pandemic. How can we advance by a decade so that we manage those conditions before they become too challenging for patient themselves.
Oh, I love that example. That's so exciting and so much value to the patient, right? To not have to travel necessarily to get care, to have the convenience of more frequent touch points. That's fantastic. James, over to you. How can the life sciences sector help the system in its recovery and help drive positive outcomes for patients?
Yeah, great question. Probably I'll frame my response in three areas. The first is something we haven't talked a lot about yet today, but is ever present in the conversation, which is health human resources and the constraints that's creating on people, like real people, as well as the system. The second is efficiency and productivity of the current system and things we can do there. And then the third, I loved Andrea's framing of reimagining the system, right? I have a thought there as well. So, in terms of health human resources, a couple of things we can do as industry a little bit laterally, and that's really just to advocate with governments, with our voice, with governments and policymakers around the importance of looking at creative immigration solutions, creative recertification solutions, division of labor, rethinking who's doing which jobs in which facilities, to really step up efficiencies in what is effectively a crisis right now in terms of people leaving the profession at large, retiring early, or just absenteeism and what some are calling the sixth wave. I'm not quite emotionally ready to call it the sixth wave yet, but obviously absenteeism is a big problem. So we can't fix a system right now without addressing immediately health, human resources. And J&J has a role to play here, as does industry. Things like onboarding and training OR nurses and scrub techs, for example. We've got great technology that combines virtual reality and augmented reality with companies in Canada, HoloLens, Auger, et cetera, that will allow us to really accelerate the time to productivity of a new nurse who's either being retrained or learning a new area. So I think that's a big area. I think efficiency and productivity of the current system, anytime we talk to OR managers right now, their biggest thing that keeps them up at night is efficiency. How are they going to clear this backlog? And so, again, a close to home example, we work closely with a thing called the Surgical Process Institute, which helps to really standardize and optimize procedures, complex procedures. Could be a complex a spine procedure that's 8 hours in length, to really try to increase efficiency of those types of procedures, standardize them. That not only shortens the time of the procedure, but ideally makes it easier for these new staff that we're talking about to understand and support and aid in that procedure as well. So there's ways that the life science community can absolutely partner to help on efficiency and productivity. And I guess something that we all need to do, again, borrowing Andrea's phrase of reimagining the system, I believe, and many around me believe, that now's the time to be thinking about this notion of, I guess, parsing out parts of the system. Our system is homogenous generally in most of Canada, and acute care, things like cancer diagnostics, cancer procedures, cardiac procedures, orthopedic procedures, et cetera, were effectively all held hostage because we had to free up bed and ICU capacity for the subsequent and greater surges of COVID entering the hospital. So all of that was done in one site, whereas there's different models around the world, particularly the US, where alternate sites of care have been adopted. It is a challenging conversation because, unfortunately, the simplistic view of that is private delivery of care, and the whole specter of a two-tiered system starts hitting people's mind space. But the reality is provinces like Quebec, Alberta is progressive in this regard now as well, are trying to create a second lane that isolates these procedures that can be done more efficiently, frankly, outside of the traditional tertiary and quaternary centers that exist today, such that if a crisis hits in the future, it's publicly stewarded care that happens to be delivered in a different site, a different domain, not a two-tiered system that people are concerned about. And I think that that notion of imagining a system will not only help us clear the backlogs that we're experiencing today, but as I said earlier, pandemic-proof the system a little bit should a future crises hit us as well, so that those patients aren't hijacked through the necessary work of managing a pandemic.
Yeah, James, I remember having this conversation after SARS, right? We discussed, wow, there's some things that shouldn't be happening in hospitals. Now, the COVID-19 pandemic, has been much more active in the community, but I think that thinking still kind of held, right? Like that there's some things that maybe the hospital isn't the right place to deliver, particularly during a pandemic, but also just generally. Are there more efficient ways? Are there ways to make it more patient-centered if we take it out of the hospital context? So that conversation continues. Janissa, how can the life sciences sector really help the system recover from what has been, just a really difficult 2 years, particularly for the people working inside of it, and then of course all of the patients who are waiting to receive care for other conditions?
Thanks, Jody. And to expand on what James and Andrea mentioned, I'm also going to talk about it I would say in 3 different areas. I also want to mention the human resource component and the manpower. We saw the struggles in COVID, and what we do need to move going forward is planning and investment in the various healthcare resources for the various positions. I'm going to take this opportunity to actually call out the medical lab technologists that actually carried our testing throughout the pandemic, and it is quite an opportunity because it is Lab Tech Week this week. So, and I really want to call this group out because they did a fantastic job during the pandemic. And so we do need, some planning in this area in various sectors in health for that human resource component. The other piece that I wanted to talk to a little bit about was about virtual care, which I think everybody's touched on it, including you, Jody, where we need to expand, where we put the patient first and improve access to healthcare. So we've seen it. We've seen a shift, a paradigm shift in the pandemic, where we were able to do virtual care from doctor appointments to self-collections in the COVID testing. But we can expand and improve on it. So there's various digital technologies that we can access and programming solutions that can simplify workflow. And that will also bring in the efficiencies and productivity that James spoke to. So there's a lot of opportunities that we need to work on. There's also service delivery models that we should look at, where we transition, to technologies that are available. So there's a lot of interest in HPV testing becoming a cervical cancer screening tool going forward. And that can be a sample for self-collection. So it will prevent patients going to a physician when you can actually collect that sample. And then I will talk about the last piece is the collaboration that we've been talking about right from the outset of our conversation, is to embrace that public-private healthcare model. It will alleviate pressure from hospitals. And if you can decentralize with virtual care, routine collections and testing, then you can have hospitals focusing on acute care and avoid backlogs that are associated with routine care. So there's a lot of opportunity, but it requires the appropriate planning. The one phrase that I liked, and I think it's actually something that will actually truly will be a shift in how we actually look at medicine and how we deliver care, is we need to move from that emergency mindset where you break glass emergency to an always on system. So we were crisis ready, and we got crisis ready in a crisis. We need to actually now expand our capabilities and planning to actually always be ready.
Yeah, it's such an important point. We can still have a single payer system, but have, we still reimagine care. As you've all said, we can kind of actually have our cake and eat it too on this one. So, thank you for highlighting the opportunities. Andrea, you had mentioned data a number of times. I wanted to talk about how would improved data infrastructure show up to patients? Because it sounds kind of boring and awful and expensive, to be blunt, but how does it connect to the patient? How would it be visible to the patient, and how could it improve care?
Thank you, Jody. I was, looking forward to this question because, as you heard, it's I'm very passionate about this topic, and I firmly believe that data infrastructure is the key to a sustainable, solid healthcare system. So let me do a parallel here, which I think it's very relevant. Is just as internet and social media led to a democratization of access to information, data interoperability can really democratize access to quality of care. That's basically the essence, and how this can really can be brought down to the patient level, right? So having better data infrastructure that they can talk to each other, that they can be utilized, they can harmonize, that will improve efficiency and patient care. I mean, we had an example during the pandemic, but I think it's very clear across the board. We'll have to identify significant at-risk population, right, that they could benefit from urgent intervention. Then we can move from reactive to proactive, and as I said before, how can we start a decade before? So in terms of identification, prevention, so that we don't end up into hospital and overwhelm the system. I think we'll also let into personalization of care, right? So when we're able to reach out, we have a data set of information, we can create a better customer experience. And ultimately, if I have a better customer experience as a patient, I'm engaged, right? So I think the worst is we have a great system, very efficient, but patient is engaged. And we know for many conditions, actually for all of them, we need patient engaged, that they can take care of their condition proactively. So it's basically really creating a more equitable system. And if I can just summarize, it's like having patient being able to see the right doctor at the right time, in the right place, whatever it means. So this is, and I think, this is I think Canada will be a great place. I've been, around the globe, with a provincial setup, with also the investment that they're making, not just in terms of equality of care, but I think the consequence of having a better data infrastructure is to attract more investment. So once we know the condition, we can develop better drug that they can fit for purpose. So just creating a virtual circuit for life science, the system itself. So I'm really looking forward to engage, the collaborative, because that's, I think, what we have to do to really make sure we move into a place where data will drive decision better and more equitably.
Yeah, all great points. And of course, we saw Israel was able to leverage their data infrastructure in their vaccination campaign and even to be able to secure some earlier access. So, very, very tangible for the patient. James, can I invite you to speak to how would an investment in data be visible and deliver value to patients?
Yeah, I mean, first of all, Andrea, really great perspective. Agree with everything you said, and maybe I'll just add a couple of others. First, I guess in terms of patient experience, I mean, one of the obvious ones we talked about, virtual care, right? And so imagine a patient who actually has access to all of their health information in one place, and imagine that experience. We've got a phenomenal system, but one of the challenges of our system is this primary care specialist model, where sometimes, not always, there are silos and breakdowns in communication, and especially the older generation who are dealing with complex burden of many chronic diseases, right, with many medicines on board, many procedures, et cetera. And it's very difficult for our system to talk to each other. So the promise, I think, from a patient perspective is that, an integration of this data would allow specialists, hospitals, primary care, labs, like everybody to speak to each other, which I get is a Pollyannic view and a very easy thing to say and a very difficult thing to deliver on. But I think we just need to continue to work at it, because at the end of the day, the patient experience will be better, and I believe patient outcomes would be improved as well. I think the more specific view maybe to the life sciences industry is that, we talked a lot about collaboration. Integration of data and collaboration is critical going forward as well. Now, the bar on this one is very high, and I think we all get it as private industry leaders here, is that issues such as patient privacy and cybersecurity are, paramount to this discussion, and we have an obligation to get it right. And the public should be scrutinizing these types of decisions. However, we're now at a tipping point of where technology and biopharmaceuticals and medical technology are leading to complex personalized treatments of complex cancers. Just look at CAR T therapy, whereby a supply chain is not a supply chain for the world, it's a supply chain for a person, right? And you need personalized information to make that kind of complex supply chain work efficiently. And look at, in my area today, digital robotic assisted surgery. The promise of this is not just to create better efficiency in procedures, but to actually, ideally a promise for better patient outcomes as well, based on a sharing and integration of data at the aggregate patient and surgeon level. So I think we'll increasingly as industry need to rely on this connectivity to deliver the full extent of the value of our future portfolio, our innovation portfolio. And my concern would be that if we don't create a collaborative and trusted ecosystem on data integration, the Canadian healthcare field and us as citizens may lose out on adopting some of these novel technologies, because they are now coming. We've talked about them a lot. Some of them are here, CAR T therapies, robotic assisted surgery, but that's the future of innovation in our sector. And if we don't think about a safe way to connect, we'll lose out on the promise of that innovation and the benefit to patients in future as well.
Great points, great points. Janissa, what's your perspective? How would improved data infrastructure be visible to patients and add value?
I actually do agree with what Andrea and James already mentioned, and I think they covered a fair bit of it, but there's a couple of points that I wanted to make. One piece is I think patients would see this if we actually invest in advanced analytics to forecast potential patient demand and manage real-time system capacity to enable us to be more agile and in response to fluctuating volumes. So that will actually improve the patient experience. So there's a lot of room to actually invest in these analytics. With COVID-19, as we saw cases fluctuate in communities across Canada, we were not able to predict demand. We saw this, as you mentioned, in other jurisdictions where they were actually to plan a little bit better than what we could do. So if we could actually look at our operational plans and match supply with demand. So in this in turn as well, will actually give you a better patient outcome and patient experience. Now, from the laboratory perspective, there's a lot of opportunity, and both James and Andrea spoke to what's in the future for that healthcare patient. So we actually have a lot of laboratory patient data. So physicians have physician data, and the radiology and diagnostics have their data, but we have an immense amount of lab data for every patient, and we could support several initiatives by developing a reporting and analytical experience that helps healthcare practitioners to identify high-risk patients and implement more effective clinical practices. So it's looking at whether it's just testing efficiencies, disease prevalence, antibiotic sensitivity, and service delivery, procedural issues, and so on. So there's a lot of data out there that we're not utilizing effectively, and there's opportunities to actually use them for the betterment of patient care and also improve the practitioner's ability to actually treat those patients as well. So I think I'm actually looking forward to actually us improving how we use data.
Well, you're not going to believe it, but we're out of time. Thank you so much. All of your comments were so fantastic. I'm going to give each of you an opportunity to conclude and offer closing remarks. Janissa, you just spoke, but can I invite you to kick us off in terms of closing remarks?
Thank you, Jody. And yes, I do. I also can't believe the time's almost done, but it was actually it was pleasurable to actually be on this panel with James and Andrea. What we did see, and we spoke to this earlier, that the COVID-19 pandemic proved that the public-private partnerships work well, they're efficient, and they reduce the risk of us overtaxing the public system and create a better patient experience and access. Now, from a community laboratory perspective, such as DynaCare, we actually can complement a public healthcare system, and we are becoming increasingly vital as Canada's population increases, putting an additional pressure on already taxed system. I know we spoke about this at length. There's a lot of opportunity in this area. And what we saw, and I spoke to this earlier, throughout the pandemic, DynaCare demonstrated that private organizations have agility and resources to respond effectively to a public health crisis, and also just to support healthcare. So these public-private partnerships work well for both patients and the system, and we should take advantage of that. What else we saw, and I spoke to this earlier, and so did you, about communication. The pandemic taught us that regular and open communication between industry and government can be effective in streamlining change management. This should continue outside of a health crisis, but will require active engagement, clear goal-oriented purpose, and also accountability. And I strongly believe, and I think I hear this from our panelists as well, it would be a shame to lose this collaborative bonds that have been forged during the pandemic. What we saw in the pandemic, and I think we all spoke to this, was agility and speed is now the new basis for differentiation. The pandemic defied expectations of how we actually, respond and how to various tools and how information became available. And we saw this when we actually looked at benefits of masking, risk of new variants, whether it was challenges with herd immunity or boosters. It required significant change in behaviors. And we had to balance this new evidence with response plans that were done in a very timely manner, but with skepticism and frustration. But what we do know, and we saw that worked really well, was strong agility and communication. And this we need going forward as well. Recently, there was actually an article in the Canadian Journal of Health Technologies where they showed trends in healthcare. And at Dynacare, we actually focus on quite a few of them, which includes remote diagnostics, which we spoke at length today about, and molecular and genomic testing. And these are the technologies that during the pandemic have been phenomenal, and they have the potential to truly fundamentally shift the way healthcare is provided and accessed in Canada within the next 2 years. So we're going to see decentralized collections and testing provide Canadians with better access to routine healthcare, and this should allow hospitals to focus their existing resources on core functions. We also do need to ensure success in future is to invest in disease surveillance, response systems, and disease prevention. And this will help us get more prepared to the next major, whether it's infectious disease or any other healthcare threat that we have. The one thing that we didn't speak to, and I wanted to just mention as my last point, one key lesson that we all learned was the need for humility. And we all saw the need to continually learn, and this has never been clearer, so that we can continue to adapt to today's crisis and prevent the next one. So thank you, Jody, for moderating, and thank you to James and Andrea for engaging discussion. And thank you, everyone, for joining us virtually this afternoon.
Well, exceptionally well said. Thank you so much. James, over to you.
Sure, thanks, Jody. And I want to echo Janissa's comments. It's been a pleasure and really enjoyed the discussion today. One of the central themes of today, I'll start with collaboration, right? We need to complement kind of what we've learned in that respect. And the other thing we talked a lot about today was, the fact that the well-intentioned biomanufacturing strategy already declared well before recent life sciences strategies, strong signals that the governments are now starting to voice an interest in underpinning this sector and this industry, which I think is a great step forward. I hope longer term everyone will agree that we ultimately need more resilience in healthcare, not just for the health benefit of Canadians, but to shore up the broader economy at large. And I've shared this in previous panels. This notion that what we saw during the pandemic is that health is wealth. And I was really pleased to hear Minister Duclos frame it in his own words today as well. These two imperatives, health and wealth, are not trade-offs. And in fact, Canadians in recent Ipsos polls have said that they value health attainment today more than even economic growth, if you can believe it. And that will maybe translate itself through the upcoming Ontario election. We'll see. But they really do go hand in hand. And so for too long, we've narrowly viewed, as someone said, healthcare as a cost to be managed versus an investment in our people and economy. So I think this means we need a resilient life sciences sector that is, globally integrated. That's actually something we didn't really touch on much today, but maybe the topic for a future chamber discussion. But also, a sector and health system that evolves based on the lessons and accomplishments, many of which we've discussed today through the pandemic. And those include, as we discussed, federal, provincial, and territorial investment in a broader strategy. We discussed that at length today. It involves an environment that values health innovation and creates a patient and market access environment. That's something we could talk further about another day as well. But that's really supportive of the adoption and innovation around new technologies. I believe this will drive this virtuous cycle of improved patient outcomes, economic growth, and increased investment in domestic R&D. Something that Mr. Duclos has a vision towards, and some of the provinces do as well. And finally, couldn't close without closing on collaboration, so aptly discussed today. What I called out as Senator Harder's Grand Alliance, whereby we work together to solve complex health system needs and ultimately integrate ourselves aligned around the delivery of value to Canadians in our universally funded system. So, with these areas of focus, I trust they'll create a more sustainable health system. We have an opportunity, as Andrea said, to reimagine the health system. And to your point, Jody, have our cake and eat it too. Really to the ultimate benefit of our population health, but also our economic success as Canadians as well. So excited for what comes next.
Well, thank you so much. Andrea, your last words.
And thank you. I just want to first say thank you to Janissa, James, you, Jody, and everybody attending. Was great. You see the level of collaboration, even from this conversation. I'm sure it's going to trigger a number of great things moving on. So and I'm going to quote you, James, on health is wealth, and I think if we want to reimagine the medicine, we need to put this at the core of everything we do. And this shift have been more than 20 years in industry, and it's the first time I hear health is wealth, and working for a better system will be a source of economic recovery and progress. So that's really great to hear. Just I want to close to say, we have been able to solve big problem, right? So I think why we are here, why we collaborate, is to solve big problem. We've managed to work on a crisis. And I think it's important that we have under focus also what are the big problems to come, next. And if we take, the issues that drive the most mortality in the country, the most hospitalization, the most cost for the system, so that we are, able, if a next crisis is going to come, to be ready. And I think we're working as we speak on, cardiovascular disease is one of the major issue for most of the country across the globe. I think would really be great if we can test them in public and private partnership to really solve big problem. So looking forward, and thank you again for having us here.
Well, thank you so much to the panelists and for the audience for your question. This was a great conversation, and I'm really appreciative of all the thoughtful comments and optimism that you brought to the discussion. Next up, I'm happy to welcome everyone to listen in to a conversation with Rania Al-Mazzari, Head of Government Affairs and Market Access at GSK, followed by our second and final panel of the afternoon, Positioning Life Sciences as an Economic Growth Vector. Thank you all, and have a great rest of the afternoon.